Bon après-midi à toutes et à tous. Good afternoon, everyone. La première date cible de notre plan de réouverture était aujourd'hui, soit la date à laquelle nous espérions assouplir certaines restrictions imposées depuis 16 mois. Mais nous n'avons pas tout à fait atteint notre objectif. Il nous reste du travail à faire. Jusqu'à ce qu'au moins 75% des citoyens du Nouveau-Brunswick aient reçu une première dose du vaccin contre le COVID-19, Santé publique recommandera que les restrictions en place demeurent en vigueur. Until we have 75% of New Brunswickers with at least one dose of a COVID-19 vaccine, public health will recommend that all current restrictions remain in place. As of today, 70.3% of New Brunswickers have been vaccinated at least once against COVID-19. That is 487,408 of us. And it sounds like a lot, and it is. However, our vaccination rate is higher than all of our Atlantic neighbors and exceeds Manitoba and Alberta as well. But as good as this is, it's not quite good enough, and so we have to keep going. Pour limiter les répercussions des éclosions futures de COVID-19 et pour prévenir les maladies graves, les hospitalisations et les décès attribuables au virus, il faut vacciner au moins les 3/4 de la population. Si nous n'atteignons pas cette cible, nous courons le risque inacceptable de réanimer ce virus. Unless we achieve this minimum level of vaccination, loosening restrictions could lead to another wave of infections and serious illness that would overwhelm our healthcare system. When we get to 75%, and I'm confident that we will get there in the coming days, we will be able to slowly remove some of the limits on public movement and gathering. But not until then. We will not settle for good enough. Close may count in horseshoes, but not in pandemics. That is why I urge every New Brunswicker who has not yet received their first dose of COVID-19 vaccine to get vaccinated today. We have ample supplies of vaccine ready for use, and we have appointments at the Regional Health Authority clinics, as well as participating pharmacies waiting to be scheduled. And many New Brunswickers have booked appointments to get vaccinated in the days ahead. If you have not had your first vaccination and are waiting to get your if you have had your first vaccination and are waiting for your second shot, I have good news. Beginning today, anyone who received their first dose of COVID-19 vaccine prior to April 1st can book an appointment for their second dose of vaccine. And if you have a copy of your record of immunization, which you would have received when you received your first dose, you can book your second dose through www.gnb.ca/bookavaccine or through a participating pharmacy. If you got your first dose at a pharmacy, the pharmacy may have given you an appointment for your second dose or may reach out to you. Please check a pharmacy's webpage or social media for availability before calling the pharmacy. Those who registered online for an appointment at a clinic offered by Horizon or Vitalité Health Network will receive an email reminder that it is now time to register for a second dose. Le 14 juin, les personnes qui ont reçu leur première dose en avril seront admissibles à recevoir leur deuxième dose. À compter du 21 juin, toute personne qui aura reçu son premier vaccin au moins 28 jours auparavant pourrait prendre rendez-vous en vue de recevoir leur deuxième dose du vaccin contre le COVID-19. On June 14th, eligibility for second doses will expand further to include those who received their first dose during April. On June 21st, anyone who is 28 days past receiving their first dose will be eligible to make an appointment for their second dose of a COVID-19 vaccine. By getting vaccinated with your first or second dose, you can help us take a step toward the normal summer that everyone wants. Aujourd'hui, Santé publique confirme qu'il y a un nouveau cas de COVID-19 au Nouveau-Brunswick. Il s'agit d'une personne résidant dans la zone 3, sur la région de Fredericton et de la vallée de la rivière Saint-Jean, qui est un contact d'un cas déjà confirmé. Il y a présentement 111 cas actifs de COVID-19, dont 3 citoyens du Nouveau-Brunswick qui s'isolent à l'extérieur de la province. Today, Public Health has reported one new case of COVID-19 in New Brunswick. This case is a resident of Zone 3, which is Fredericton and the St. John River Valley. This is a contact of a previously confirmed case. There are now 111 active cases of COVID-19. This includes 3 New Brunswickers who were infected and are self-isolating in another province. There are 4 New Brunswickers now in hospital due to this virus, including 2 requiring intensive care. This includes 1 New Brunswicker who is hospitalized outside the province. Everyone who has become infected with COVID-19 or is self-isolating to prevent the further spread of this virus has loved ones who care for them and who need our support. I ask that you keep these New Brunswickers in your thoughts and prayers. Public health guidance and advice to prevent the spread of COVID-19 remains in place. It is still very important to wear a mask in public places, maintain 2 meters of physical distance, and wash your hands regularly and thoroughly. These actions continue to keep us all safe. But the most important action that any New Brunswicker can take right now to limit the impact of COVID-19 is to get vaccinated. New Brunswickers in their teens, 20s, and 30s happen to have the lowest vaccination rates by group, and if you have seen our visual on social media, it really is quite good in terms of showing visually where we're at and where we need to go. So we need to get this group that caught up with the other folks that have been vaccinated at higher rates. Now, that having been said, the earlier age groups that were able to be vaccinated, obviously they've had quite a long time to get there. We've only really made announcements for younger age groups in the last few weeks, so we need a bit more time. So we really need those people to book their appointments now. So again, realizing this group has really only just been eligible for the last month. For those under 18, it's been less than 2 weeks. So there's no time like today to book a first dose appointment. And I am appealing directly to the young people of our province. When you get vaccinated, opportunities will open up that you have not had in more than a year. So spending time this summer hanging out with friends and at the beach or at the camp and having bonfires and barbecues, that can happen. We can get to this as soon as enough of us are vaccinated. So that's the trade-off. By being vaccinated, you will protect your parents, grandparents, and young children from the threat of serious illness, and you will help ensure that our healthcare system is not overwhelmed by yet another wave of infections. And really and truly, the hard work of the last year and a half has really been at the expense of New Brunswickers sacrificing with travel restrictions, with border measures, and other very, very difficult challenges in terms of not being able to see loved ones, et cetera. So now is the time to get vaccinated so the vaccines will start to do that heavy lifting and that work. If it's not enough to do this for others, then do it for yourself. We do know that with the variants of concern, we see more severe symptoms, more severe outcomes. So I know that thousands of young New Brunswickers have taken this step, and I applaud you for it. Not just for the acute illness and the risks, but also for the long COVID that we know can happen as well. So please encourage your friends to join you, colleagues, community members, etc., firmly but with compassion. We need everyone who can get a vaccine to do so as soon as you can. So there is a path to a normal summer for all of us in New Brunswick, and it leads through a vaccination clinic. Comme l'été semble s'être pointé le bout du nez plus tôt cette année, je tiens à rappeler à tous les citoyens de la province qu'ils doivent se protéger en temps chaud pour demeurer en santé. Avec des avertissements de chaleur en vigueur dans la majorité de la province au cours des prochains jours, il est d'une importance cruciale pour tous de bien s'hydrater. Buvez des liquides frais en bonne quantité. N'attendez pas d'avoir soif. Évitez les expositions excessives au soleil. Prévoyez vos activités à l'extérieur à un temps de la journée où il fait moins chaud. Portez des vêtements amples et légers et demeurez à l'ombre autant que possible. As summer has come early this year, I want to take this opportunity to remind all New Brunswickers to protect their health during hot weather. With heat warnings now in effect for most of the province over the next couple of days, it is vital that everyone stays hydrated. Drink plenty of cool fluids and don't wait until you feel thirsty. Avoid excess exposure to the sun, plan outdoor activities during the cooler hours of the day, wear lightweight and loose-fitting clothing, and keep to the shade when you can. And while respecting COVID-19 restrictions, please check in with vulnerable neighbors and family members, especially the elderly, to make sure they are coping with the heat. Summer is here and we all want to enjoy it to the fullest. Let's make sure we do it safely. Thank you very much.
Good afternoon. Bonjour. When we set our targets for this summer, we did so to be ready for July 1st, to be ready for the middle of August. Summer has come earlier than we expected, and that is a concern in many ways because people will want to be outside. We're seeing examples of that already. People want to be together. They want to do what they always have done during the summer. Right now, we're at the very edges of being in a safe position to do so. So we need to continue to stay focused, and we need to find ways to just cross the line here so that we don't take any unnecessary risks. When we announced our path to green, we set ambitious goals for each phase. Ambitious, but certainly possible. We did this because we're optimistic about the future and New Brunswick's potential. Pendant cette pandémie, nous avons démontré plusieurs fois que les gens de Nouveau-Brunswick peuvent accomplir de grandes choses quand ils sont déterminés à le faire. Et nous avons travaillé ensemble pour assurer notre santé et notre sécurité. We looked at the numbers and we saw that June 7th was the earliest possible date where we could reach 75% of New Brunswickers 12 and over vaccinated with their first dose of COVID-19 vaccine. Well, we have not reached 75%. We have made great strides towards reaching this goal. I wish to thank the many individuals and businesses that stepped up during this past week to advertise, to encourage, to get people that they knew to be part of the success story that New Brunswick's been to date, and we certainly want to continue. As of this morning, 70.3% of eligible New Brunswickers have been vaccinated with their first dose of COVID-19 vaccine. While those numbers are lower in the younger age groups, I realize access has been open to them only for a few weeks, but we're encouraged of the numbers and we're encouraged that that will continue to grow quickly. I'm also encouraged of just how fast that some of the numbers are rising in that category. Just in the past week, there's been a significant jump in the number of people aged 12 to 19 who have been vaccinated, rising from 16.5% to 44.7%. À l'échelle nationale, notre province est en 4e position pour la plus grande proportion des personnes qui ont reçu une première dose de vaccin. Cela reflète notre mission et la manière dont les gens de Nouveau-Brunswick ont accepté cette mission. I want to thank everyone who has gotten vaccinated over the past few days, as well as those who were quick to make their appointments as soon as they were eligible to do so. I also want to thank those who have made appointments and will be getting vaccinated in the coming days. You stepped up to protect your loved ones and your communities. You have stepped up for our province. I am confident that we will reach our goal of 75% over the coming days. Ce n'est pas le temps de se discourager. Il faut maintenant rappeler aux personnes qui nous entourent et qui n'ont pas encore pris le rendez-vous pour le vaccin et qui ne sont pas certains de le faire, que c'est important de se faire vacciner. Chaque personne compte. This is how we will protect our most vulnerable citizens as well as those New Brunswickers who are unable to get the vaccine. This is how we will protect our province from COVID-19. This is how we will have our family and friends return for summer, and we're so excited about that possibility. I have 3 grandchildren, my wife and I outside of the province in Ontario, and we're really excited about them coming home this summer. It's been a long time for many, and this has to be a summer where we can reunite all of our families. We have lots of vaccines, and there are thousands of appointments available through pharmacies and clinics across our province. Cette clinique offre la vaccination selon le principe de première arrivée, première suivi, et vous n'avez pas besoin de prendre au rendez-vous. Il n'a jamais été aussi facile d'obtenir votre première dose d'un vaccin contre le COVID-19. Working together, we will reach our goal of having 75% of eligible New Brunswickers vaccinated. When we get there, we will enter our first phase on our path to green, and restrictions will loosen. As we recently announced, there will be no isolation or testing requirements for those traveling within Atlantic Canada or Avignon and Témiscouata region in Quebec, with the exception of Nova Scotia. Cependant, les gens devront encore enregistrer leur voyage pour entrer dans notre province. Other changes for when we reach 75% of eligible New Brunswickers is less restrictive rules for compassionate travel in New Brunswick, where isolation is required with testing on days 5 to 7, and they can be released with a negative test. Cross-border commuters and truckers will no longer be subject to testing and isolation requirements. Other workers traveling from outside the regions previously noted must isolate with testing on days 5 to 7 and release with a negative test unless a person is under an existing work isolation. This includes rotational workers who are outside of Atlantic Canada and Quebec areas where travel to New Brunswick is not restricted. This is a restriction from the previous 14-day mandatory isolation. There's so much more freedom to be gathered when we reach 75. We have freedom now that others are just now attaining. So let's go the next step, but let's be diligent and let's persevere to reach the numbers to have greater assurance that we will not have an outbreak at the end of this pandemic. Also, when we reach 75% with the first dose, New Brunswickers will be allowed to contact with family and friends in areas at the yellow alert level. Indoor informal gatherings will be limited to 20 people or fewer, while indoor formal gatherings can be up to 50% capacity with an operational plan. Les rassemblements informels à l'extérieur seront autorisés, mais les gens devront respecter une distance de 2 mètres entre chaque groupe. Les rassemblements formels à l'extérieur seront autorisés à capacité maximum, mais les gens devront respecter une distance de 2 mètres entre chaque groupe, et un plan opérationnel devra être en place. Organized sporting activities will then be permitted. Games and competition can open to those in Atlantic Canada and bordering Quebec areas where travel to our province will be permitted with an operational plan. Faith gatherings with an operational plan can move to a 50% venue capacity. Dans cette première étape, toutes les autres restrictions qui ont pour objectif de maintenir la sécurité du public vont demeurer en place. Cela inclut l'obligation d'enregistrer un voyage pour entrer dans la province, ainsi que le port de masque. C'est une étape importante qui va nous aider sur notre route pour retourner à une vie normale. I know we can reach that first step of the 75% first dose target with the help of New Brunswickers. I know we're now at the tail end at 70.3%. And many of you may say, okay, well, that's good enough. It's not good enough if we have an outbreak and then we lose it at the very end of this COVID pandemic when we have so much to gain for the summer months. So we are indeed on a positive trend. We're on a positive trend with only 1 case today, 4 people in hospital. We are on a positive trend with our vaccinations going up at 70.3%. We can do this. We were averaging 1% a day in the last 2-3 weeks, and we can continue to do that. So that puts us to the end of the week. But right now, our target is not a date. Our target is a vaccination percentage. Our target is 75%, and we need to get there to make sure that we're ready to go the next step with not only the second vaccines, but be ready for July 1st when it comes, and to be able to celebrate like we haven't for 2 years, to be in a position where we once again can enjoy friends and neighbors and families from across the country, from other parts of the U.S. We need to get our house in order so we will be safe one another, and we can do this. We are looking at different methods of vaccinations. We're looking at different ways to get vaccination units to people, different clinics, different incentives. We need people, though, and businesses to help us to realize that it's everyone's job to put us over the finish line. The first dose of COVID-19 vaccine offers some protection against the virus, but we all know we need the second dose. And I know a lot of people have received their first dose, are anxious to get the second. We believe that that'll be consistent. If we reach 75% with first dose, then we know we can get quickly and we know who they are, we know they'll be vaccinated, and we can reach our maximum levels quickly of 2 doses. Comme le mentionné de le Dr. Russell, certaines personnes peuvent commencer à prendre rendez-vous pour leur 2e dose aujourd'hui, soit plus tôt que prévu. Jusqu'à maintenant, notre objectif était d'offrir une première dose à tous les gens de Nouveau-Brunswick, afin que le plus grand nombre de personnes possible puissent avoir une certaine protection contre la COVID-19, parce que nous avions un approvisionnement limité en vaccins. This journey we've been on hasn't been easy, but we are close to reaching our destination, and we all want to see life return to normal. Make your appointments and get the first dose of the COVID-19 vaccine, and when it's time, get your second dose. Let us get back to a summer. Even though it could be a little different, it's going to be so much better. Protect yourselves, protect your loved ones, and get our province to green. Thank you. Merci.
Thank you, Premier. Dr. Russell, merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Voulez-vous assurer de désactiver le son de vos micros? Ladies and gentlemen, we'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Derek Dubé, TVA. Travis Fortnum, Global News.
Hi there. Not sure who wants to answer my question, but Premier Higgs touched on possible incentives to get our percentage of vaccination up. Wondering if someone could expand on that, what we might be looking at.
Yes, I will. I was probably getting excited there. In relation to what we've seen, some of the businesses have come forward, and I know that there were some that were saying if you gave proof of vaccinations and you went to a dealership and then they offered a free beer at one of the pump houses, and so there were cases where we've seen businesses step up like that, and that's what I was referring to. We are offering free vaccines throughout the province, and so I think in that sense, there are areas that may offer. We talked about if the trucks are roaming around the beaches, but we don't know if we're going to have a heat wave like this for long. But the ice cream trucks, things like this, where people would see an opportunity just to one more encourager. But as far as someone thinking that we would offer cash incentives to get a free vaccine, that won't be the case.
Thank you. Maude Montembeau, Radio-Canada.
Oui, bonjour. J'espère que vous allez bien. J'aimerais savoir qu'est-ce que ça signifie pour la suite, en fait, entre autres pour le 1er juillet, pour le reste du pays. Est-ce que la stratégie choisie à l'heure actuelle ne plonge pas, entre autres, l'industrie touristique dans une forme d'incertitude?
Doesn't matter.
Go ahead.
Alors, la question, c'est le fait d'avoir des touristes ici après le 1er juillet. Et si c'est
c'est une question un peu plus politique. Si vous voulez la répondre en français, ça va me faire plaisir. Mais c'est surtout le choix du gouvernement comme ça. Est-ce que maintenant, là, l'industrie touristique ne saura pas sur quel pied danser? Donc, qu'est-ce qu'on dit aux clients? Est-ce que vous venez ou vous ne venez pas le 1er juillet? Donc, on voit que la première cible a été ratée. Qu'est-ce que ça signifie pour la deuxième et pour le reste du pays?
So I guess I'll answer that, and Dr. Russell and I will probably discuss this in addition to the reports we'll get from public health in relation to the vaccine levels. So our first target was a 75% target for certainly to ensure that we were at the point where we felt comfortable to move to the next phase. And the next phase after 75% was basically to open up to second vaccines and get to the 20% level by July 1st. Now, I made a point in my address that if we receive 75% of people that have taken the vaccines, we're pretty sure that they'll take the second one. So 20% to reach July 1st should not be a problem. And we'll know who everyone is that's been vaccinated, so it'll be easy to work with people to get that across the line, I would say. So we still are very focused on the July 1st date, and I don't see any reason why we can't meet that. I mean, this could very much have been a target of 75% versus an actual date. But I think it's important for us not to lose sight that even though we're a few percentages behind, so 4% to be exact, we feel comfortable with the levels of certainly the age groups 12 to 40. That's where our opportunity would be. And we know this hot weather doesn't necessarily cause one to focus on vaccines. And we know that and the issue in the younger generation is a little more difficult, as it doesn't seem maybe is quite the priority. But as I've said throughout this entire pandemic, and as we've worked together with public health, you know, it's about protecting each other. It isn't about just protecting yourself. If you don't feel vulnerable, think about those that could be. And so that's the help we need right now. And so go to another little less than 4%, and we need about 36,000 people. In thinking over the next, several days, we should be there and right back on track to our targets for July 1st.
Merci beaucoup. Vicky Hogarth, CHCO TV.
Thank you, Bruce. I'm not sure who my question is for. I'm just wondering if vaccination rates are consistent pretty much across the health zones, or if there's any health zone that is particularly lower or higher than the others.
Hi, Vicky. I'll answer that question. It is actually quite consistent across all the health zones.
Thank you, Ms. Hogarth. Justin Dupuis, l'Acadie Nouvelle.
Oui, oui, merci. Je voulais juste faire un suivi sur justement les niveaux de vaccination dans chacune des zones de la province. Je ne sais pas si vous pouvez donner plus de détails, des chiffres spécifiques sur les taux de vaccination dans chacune des zones.
Je vais vérifier si j'ai les taux de vaccination dans toutes les zones. Oui, j'en ai des numéros. Qu'est-ce que j'ai? C'est, dans la zone 1, c'est environ 67,6. Oh, ça, c'est les numéros de hier ou samedi. C'est pas les nouvelles. Yeah. OK. Alors, jusqu'à aujourd'hui, ce matin. Alors, la zone 1, c'est 67,6 %. Zone 2, c'est 67,1 %. Zone 3, c'est 65,3 % Zone 4, c'est 66,1 % Zone 5, c'est 66,2 % Zone 6, c'est 66,5 % et Zone 7, c'est 68,9 %. I'm just going to say it in English for Vicky. So in Zone 1, if you're still there, Vicky, 67.6% in Zone 1, 67.1% in Zone 2. Zone 3 is 65.3%. Zone 4 is 66.1%. Zone 5 is 66.2%. Zone 6 is 66.5%. And Zone 7 is 68.9%. Now, somebody doing math will add these up and realize they're not as high as the provincial rate. So there are people who were vaccinated, but they didn't provide, we didn't have access to their postal codes. So the total is correct, but we couldn't assign them to different zones because we didn't have their postal codes. Alors, pour le total, quand vous faites les mathématiques puis le calcul, ça va vous démontrer que le total pour la province est pas Quand additionner toutes les zones, ça ne va pas donner le taux pour la province. C'est parce qu'il y en avait des gens qu'on a donné leur vaccination, mais il n'y avait pas leur code de code postal. Alors, le total, ça inclut les gens qui n'avaient pas leur code postal, mais ça veut dire qu'on n'a pas pu les placer dans les différentes zones.
Merci beaucoup. Adam Harris,
Merci.
Brunswick News.
Thanks, Bruce. Question for both Premier Higgs and Dr. Russell. You've both talked about counting New Brunswickers who are vaccinated elsewhere, potentially down in Florida or Fort McMurray, places like that. Have you done that? Is that included? And is that number at all significant to the totals?
My understanding is the emails went out on Friday to collect that information to people. I'm not sure if we have it all back yet. I'm hoping that we have it back sooner rather than later so we can input that data into our totals.
Laura Brown, CTV. Laura Brown. As we wait for Laura, we'll go to Sophie Desautels, Radio-Canada.
Oui, bonjour. J'aimerais savoir, est-ce qu'on sait quels sont les combien de rendez-vous ont été pris pour la prochaine semaine pour la vaccination et si on sait si on va atteindre le 75 % et quand avec ces rendez-vous prévus? Et est-ce que tout ça, ça va retarder l'ouverture de la frontière le 1er juillet? Donc, c'est deux questions, en fait.
Do you want to start, and I'll finish?
So in relation to what it'll take over the next week, we were doing about 1% a day before, and I know there's less, we have a different demographic, and so the numbers are different in that regard, but we're still targeting for that. So, I mean, you can kind of do the math and say it'll probably take us another 4 or 5 days to get to the 75%. But the idea of July 1st, I think, is still very much intact because we will know then who got their first vaccines. Our target for July 1st is to have 20% of those with the second dose. But we know everyone who's got their first, and we know once they've got their first dose, they'll be wanting to get their second dose to complete the process. So I would say at this point in time, the current few days delay will not impact July 1st.
Est-ce que ça va en français? Oui.
Je veux juste ajouter que on a assez de doses pour donner à les gens pour atteindre notre but de 75 % cette semaine. Je n'ai pas le nombre exact des rendez-vous qui sont disponibles, mais je sais qu'il y en a en masse pour obtenir notre but. Je sais qu'aujourd'hui, il y a 2200 rendez-vous, que vous n'avez pas besoin d'avoir un rendez-vous. Et si vous êtes déjà vacciné, c'est possible d'être capable de encore nous aider à atteindre notre but. Si vous connaissez des gens qui ne sont pas fait vacciner encore, encouragez-leur. S'ils ont besoin de transport, des choses comme ça, essayez de leur aider à faire leur rendez-vous en ligne s'ils ont besoin d'aide avec ça. Alors, il y a encore des choses qu'on peut faire. Puis, pour la question au niveau de les gens qui se font fait vacciner, qui sont fait vacciner en hors de la province, l'information qu'on a envoyée vendredi, depuis ce temps-là, on a reçu un rapport qu'il y avait 300 personnes qui se sont fait vacciner en hors de la province déjà environ 2 heures après qu'on avait fait cette annonce et envoyé cette information. Alors, au fur et à mesure qu'on reçoit plus d'informations sur les gens qui se sont fait vacciner en hors de la province, on va les inclure dans les taux.
Merci beaucoup. Alex Cook, Global TV. Alex, can you unmute yourself and ask your question, please?
Hi, can you hear me?
Yes, thank you.
Hi, my question is for the Premier. What do you say to people who might be confused or frustrated with the Atlantic provinces not being totally in sync on reopening dates and vaccination targets, especially when many people, including yourself, touted the bubble's success and consistency within the region last year?
I think you'll see the bubble reunite here over the coming weeks. I think we're all trending in the same direction, and in the case of timing, it's we all want a certain level of vaccination levels to get there. So I know that we were in sync with Newfoundland, and I know the discussions that I'd had with Premier King. They were hoping they'd set June 28th, but so we all may move a bit as we need to get to 75%, so that's taken us a little longer. So I certainly wouldn't rule out the Atlantic bubble. We've been in the Atlantic region for a long time now, and it worked well last year, and I see that as well coming together over the coming weeks.
Thank you. Laura Brown, CTV.
Can you hear me now?
Perfectly.
Excellent. So I'm wondering if there are any repercussions for the delay in loosening these restrictions and by making that decision today. By that I mean, do you have travel registration forms from islanders or those in Quebec, those border communities that are being denied today to come into the province, or truck drivers who were thinking they wouldn't have to isolate this week?
Well, everything that was being done over the last while in terms of restrictions are still in place, and we last week, we certainly were given our numbers every day. People were seeing the percentage. We were hopeful about the weekend, but concerned. That's why we met last night with an update, and that's why we're here today to give people time to recognize that nothing is going to change as of midnight tonight. So there wouldn't be any plans there may have been plans that were being thought about, but they certainly will not be any different rules applied to the plans for the next several days until we reach our target. So we wanted to get out today at a reasonable time, so everyone would have time to get the message and understand that we're still on hold with our current restrictions until we reach our target of vaccinations.
Thank you. Derek Dubé, TVA. We'll move to Savannah Odd from the Telegraph Journal. We'll move on to Erica Butler, CHMA.
Hi there. Just wondering, now that there's an additional delay of maybe you're saying 4 to 5 days before we hit the 75% and move to the first stage of the Path to Green, will the exclusion of the Nova Scotia border from that first phase be reevaluated in 4 or 5 days according to the numbers in Nova Scotia at the time? And what kind of targets would Nova Scotia need to hit for that reconsideration to happen?
Well, we will be having another meeting with Public Health on Wednesday night. But as of discussions last night, there's reason to certainly be optimistic that we would be able to look at bordering regions of Nova Scotia to be included just as the same as the northern regions with Quebec. So we'll know more about that later in the week. But at this stage, I think this delay of reaching our 75% will only give more time for a similar situation to be looked at for the Nova Scotia border as with Quebec.
Thank you. Bobby Jean McKinnon, CBC. Alexander McDougall, Holton Pioneer Times. Back to Savannah Odd.
Hi, can you hear me?
Perfectly.
Awesome. My question is for Dr. Russell. Dr. Tam recently said the India variant has made second doses more urgent. So as we roll those out here, I'm wondering what public health has learned about quickly controlling the spread of the India variant, and how concerned are you that that strain could derail our reopening?
Great question, Savannah. As you know, our experience with the India variant has been mostly here in the Fredericton in Zone 3 area. So we, although I think it's in Zone 6 now is my understanding, but what we have done up until now has worked in terms of containing the outbreaks. However, again, we keep a very close eye on hospitalization rates and ICU admissions. And moving forward, that really is our goal in terms of trying to continue to protect our healthcare system, which has been the goal throughout the pandemic. And with our desire to start removing restrictions gradually, the need to get everybody vaccinated right now is very, very high to avoid that fourth wave. So right now, we've done great with our first doses. All the people that have gotten their first doses are keen to get their second dose pretty much as soon as that's physically possible. But we do still want to hit that target of 75% for our first doses. So that's what we're focused on. And in the meantime, our regional staff are working really hard in terms of contact tracing and testing. That continues to be a huge priority for us. And I do want to give a shout out to all the immunizers out there and all the pharmacists who are giving vaccines. I know from being at one of the vaccine clinics last week, you know, everyone working in these clinics is, you know, amazing. They, you know, when I was giving the Premier his dose of his vaccine last Friday, we did walk around the Brookside Mall facility, and my goodness, 15-hour days at least. The enthusiasm, the energy. I did get a message this morning from just a random stranger showing me a photo of one of the vaccine clinics in Moncton, and people were standing around in the shape of a heart, and I have to say that was really heartwarming to see. So again, we've got some momentum right now, and we want to keep going. We have goals to achieve, and those goals lead to lessening of restrictions while maintaining our hospitalization rates and ICU admission rates.
Thank you. Bobby Jean McKinnon, CBC. As we wait for Bobby Jean. We can't hear you, Bobby Jean, so I think the best thing is to send me the question. I'm going to move to Ben Wood, allnewbrunswick.com. I believe to unmute, you must press number 6. As we move, we'll go to Michael McDonald. We have Michael McDonald from the Canadian Press. Alexandre Courtemanche, Radio-Canada. Simon Delattre, l'Acadie Nouvelle.
Oui, bonjour. Une question pour la docteure Russell. Je voudrais savoir comment vous espérez convaincre les personnes qui sont encore réticentes, hésitantes à se faire vacciner. Quel est votre message pour ces personnes?
Alors, je ne crois pas que c'est nécessairement moi qui va les convaincre, mais je crois que c'est leur famille, leurs collègues, leurs différents membres de leur communauté, parce que vraiment, c'est un effort collectif. Tous les efforts et les travaux qu'on avait faits dans les dernières 15 mois, c'était comme toute la province en collectivité. Alors, c'est la même approche pour les taux de vaccination à ce moment-ci. Il faut tous travailler ensemble, parce que c'est grâce à les taux de vaccination qui vont nous donner la possibilité de lâcher un peu les restrictions très sévères qui se sont en place depuis des mois et des mois. Alors, le fait d'avoir les nombres de cas très bas à ce moment-ci, le fait d'avoir des nombres d'hospitalisation et des admissions aux soins intensifs tellement bas à ce moment-ci, c'est grâce à toutes les restrictions qui sont en place. Et ces restrictions sont vraiment difficiles à gérer pendant des mois et des mois. C'est difficile sur la santé mentale des gens qui ne peuvent pas voyager. C'est difficile pour des gens qui voulaient visiter des membres de leur famille, peut-être qui sont soit dans des soins intensifs, pas soins intensifs, je m'excuse, des soins palliatifs ou dans des foyers de soins, dans les résidences à long terme, etc. Alors, quand on soit toutes vaccinées avec nos 2 doses, ça veut dire qu'on peut lâcher beaucoup des restrictions, mais c'est un échange. L'échange être capable de lâcher les restrictions, c'est seulement si on a les taux de vaccination pour nous protéger.
Merci beaucoup, M. Delattre. Derek Dubé sent me his question. J'aimerais savoir s'il y aura des cliniques sans rendez-vous pour la 2e dose des vaccins. J'aimerais savoir s'il y aura des cliniques sans rendez-vous pour la 2e dose des vaccins.
Oh, à ce moment-ci, on les a pas mis dans l'horaire, mais ça se peut, au fur et à mesure qu'on aura besoin. On a toujours une petite liste d'attente. On sait qu'à la fin de la journée, s'il y a encore des doses qui restent, ils ont une petite liste d'attente que les gens vont téléphoner. Mais à ce moment-ci, on va n'en pas avoir à ce moment-ci.
Thank you. Bobby Jean, can we try one more time? Okay. I have her question. As I understand it, the vaccines take 2 to 3 weeks to take effect. So can you please explain why it's okay to lift the restrictions the same day people are vaccinated once we do reach 75%?
Well, obviously, the higher the rate of vaccination, obviously 2 doses is better than 1, and 75% is a target in terms of trying to have some level of protection that will allow us to relax certain public health measures at the same time as preventing our healthcare system from being overwhelmed. Again, we are not opposed to the idea that if we have to pull back on any of the changes that we make because of hospitalization rates going up or ICU admission rates going up, then we will, because up until now our triggers have really been more around case counts and contact tracing and testing and hospital capacity. If we run into trouble with hospital capacity, then that's really going to be the focus moving forward in terms of telling us where we are and where we need to be with all of our approach at this point in time.
Thank you. Michael McDonald, are you there from the Canadian Press? And Ben Wood from All New-Brunswick. Ladies and gentlemen, that concludes today's update.
Excuse me, can you hear me?
Yes?
This is Alex McDougall from Hope and Pioneer Time. Sorry, I was muted the first time, but I managed to get it figured out.
You got to speak up, Alex, pretty quickly. Thank you.
Can you hear me? Sorry, yes, sorry, I was muted. So this question is for Premier Higgs, just regarding the U.S. Canada and the Green Plan. It says for the border between Maine and New Brunswick to be open July 1st. I don't know if you had heard any updates to that. I mean, that's based on federal restrictions, so I wasn't sure if that was still, you seem to be a plausible goal, or whether that might have to go back based on what the federal government is deciding right now.
Well, at this stage, I would still leave that as an open possibility, and just as we feel that we'll be able to meet our 20% threshold and beyond on July 1st, we have had this discussion about what's going to be opening up, and I know that across the country, different provinces and their bordering states have wanted to see movement there this summer, as we do in relation to the same as our communities that we're talking about with Quebec and Nova Scotia that border one another. This is very similar for New Brunswick and communities that live very harmoniously and are interconnected with families. So I'm optimistic, but it is a federal decision. And but if we get again to a position that we're targeting, then we will have a comfort level to look at those border communities in Maine, and providing the federal requirements let us do that, and we feel comfortable, then I'm hopeful that we'll see some activity once again between our borders with Maine.
Thank you. Thank you both. Thank you, Doctor. Thank you, Premier. Merci beaucoup à vous deux. Voilà la fin de notre mise à jour pour aujourd'hui. Merci beaucoup. That concludes today's update. Thank you.